Encephalitis is a serious and potentially life-threatening condition characterized by inflammation of the brain. It can result from various causes, including viral infections, autoimmune responses, or other infectious agents like bacteria and fungi. The disease can affect individuals of all ages but is more commonly severe in infants, elderly people, and those with weakened immune systems. Prompt diagnosis and treatment are crucial to reduce complications and improve outcomes. Causes of encephalitis. The most common cause of encephalitis is a viral infection. Viruses such as herpes simplex virus, HSV, varicella zoster virus, which causes chickenpox and shingles, enteroviruses, arboviruses, like West Nile and Zika, and measles virus are frequently associated with this condition. Less commonly, bacterial infections, like Lyme disease or tuberculosis, fungal infections, especially in immunocompromised individuals, and parasites can also cause encephalitis. In some cases, encephalitis results from an autoimmune reaction in which the body's immune system mistakenly attacks healthy brain tissue. This is known as autoimmune or paraneoplastic encephalitis and is often associated with cancers or other immune system disorders. Types of encephalitis. There are two major types of encephalitis. Primary encephalitis. This occurs when a virus or other infectious agent directly invades the brain. Herpes simplex virus encephalitis is a classic example of primary encephalitis. Secondary encephalitis, post-infectious encephalitis. This occurs when the immune system reacts to a previous infection, not the infection itself. It often develops days or weeks after the initial illness and is more common in children. An example is acute disseminated encephalomyelitis, ADEM, which can follow viral infections like measles or even vaccinations. Symptoms of encephalitis. Symptoms of encephalitis can vary widely depending on the underlying cause, the severity of the condition, and the individual affected. Common symptoms include fever, headache, confusion or altered mental status, seizures, stiff neck, sensitivity to light, photophobia, nausea and vomiting, fatigue or lethargy, behavioral changes, difficulty with speech or hearing, movement or coordination problems. In severe cases, individuals may lose consciousness or slip into a coma. In infants, symptoms may include a bulging soft spot on the head, fontanelle, constant crying, and poor feeding. Diagnosis. Diagnosing encephalitis involves a combination of clinical examination and diagnostic tests. Doctors will assess neurological function and check for signs of brain inflammation. Common diagnostic tools include lumbar puncture, spinal tap to analyze cerebrospinal fluid, CSF, for signs of infection or inflammation. MRI or CT scan, to detect brain swelling, hemorrhages, or lesions. Electroencephalogram, EEG, to measure electrical activity in the brain and detect abnormal patterns. Blood tests, to identify the presence of viruses, antibodies, or other markers of infection. Brain biopsy, rare in extreme cases, a small brain tissue sample may be taken for analysis. Treatment. Treatment for encephalitis depends on the underlying cause. Viral encephalitis, antiviral medications like acyclovir are commonly used, especially in cases caused by herpes viruses. Autoimmune encephalitis, immunosuppressive therapies such as corticosteroids, intravenous immunoglobulin, IVIG, or plasma exchange may be used. Bacterial or fungal encephalitis requires antibiotics or antifungal drugs, respectively. Supportive care includes hospitalization, fluids, anti-seizure medications, and treatments to reduce brain swelling. In severe cases, mechanical ventilation may be necessary. Early treatment is essential to minimize damage and improve prognosis. Complications and prognosis. The outcomes of encephalitis can vary significantly. Mild cases may resolve completely with no long-term effects. However, moderate to severe cases can lead to serious complications such as memory loss, personality changes, speech or motor difficulties, epilepsy, learning disabilities, paralysis or weakness, coma or death. The prognosis largely depends on the cause, how quickly treatment is started, and the individual's overall health. Children and older adults are more likely to suffer permanent damage. Prevention. While not all cases of encephalitis are preventable, several measures can reduce the risk. Vaccination. Vaccines against measles, mumps, rubella, influenza, and Japanese encephalitis can prevent infections known to cause encephalitis. Mosquito and tick protection, using insect repellent, wearing protective clothing, and avoiding areas with high mosquito or tick activity help prevent arbovirus-related encephalitis. Good hygiene, hand washing and avoiding contact with infected individuals can prevent the spread of some viruses. Early treatment of infections. Prompt treatment of infections like herpes simplex virus can prevent complications like encephalitis. Conclusion. Encephalitis is a complex and serious condition that requires immediate medical attention. Though it can stem from many causes, timely diagnosis and appropriate treatment can significantly improve outcomes. Continued public awareness, early vaccination, and advancements in medical research are essential in the fight against this potentially devastating disease.
Thank you for watching. Please subscribe our channel.